Hello, 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 my friends. Welcome back to Diverse Thinking, Different Learning. Thrilled to have you joining me today. Today, we are talking about blending in, holding it together, studying social rules, and suppressing natural responses. These are not simply personality traits. They're adaptive strategies known as masking and camouflaging. And while these strategies can help individuals navigate social environments, they often come at a significant cost, emotionally, cognitively, and developmentally. In fact, research is increasingly showing that masking is associated with higher rates of anxiety, depression, and even delayed or missed diagnoses, particularly in girls and individuals with high cognitive abilities. I am absolutely thrilled to have Dr. Deanna Dow joining me today to discuss this topic. Dr. Dow is a licensed clinical psychologist and founder of Spectrum Psych LA, and she brings over 20 years of experience in autism assessment, intervention, and research. Her work spans clinical care, early identification, and parent-mediated interventions. She has trained and collaborated with some of the leading experts in the field, and she's joining us today.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Dr. Dow, welcome to the podcast.
Thank you so much for having me, Karen. I'm so excited to be here.
I am so glad you are here. And like I was saying before I hit record, I can't believe it's taken this long for me to have you on the podcast.
I know. I feel like we've been chatting for so long about all of our overlap.
We have been.
So,
yes.
So
we've worked together to support families, but never collaborated like this before.
Right.
So I'm excited to have you here.
This is going to be amazing. Can't wait for our chat.
Yes. And I wanted to have you here because of obviously your expertise in neurodivergence and autism in particular. Because when we think about neurodivergence, whether it's autism or ADHD, we often focus on what we can see, things like differences in attention or communication or behavior. But what is often less visible is the effort many individuals are putting in behind the scenes to appear typical, right? So that is really what I wanted to talk about with you today. And we're talking about masking and camouflaging, but for some people, that might be the first time they've heard it, or they've heard it, but they really don't understand it. Can you talk about what we mean when we say masking and camouflaging?
Yeah. So masking and camouflaging, when we're talking about in the context of neurodivergence, is really fitting in, right? Holding in maybe our natural tendencies of how we act, how we behave, how we emote, and doing so in a way that the individual knows what maybe is more socially acceptable or might be more rewarded within society. And so they are fitting in by masking, but it may be taking a toll because it is more effortful and it might not be their natural go-to way to interact.
Right. And often individuals describe it as exhausting. I often explain to families that what looks like coping on the outside can actually be compensation on the inside, where a child is working significantly harder than their peers just to meet expectations.
Right. And I think the number one thing that comes up in therapeutic settings is, why is my kid falling apart every time they come home from school? And this is one of the biggest reasons why, right? When you have to put so much effort into just getting through your day, especially a neurotypical setting where you know what the expectations are and you might really struggle to meet them, it really is hard. Internally, it's hard for, we see a lot of kids in clinic for anxiety and depression because they are working so hard and they know how hard they are working to try to fit in.
So what drives masking or camouflaging in neurodivergent individuals? Is it conscious, unconscious, or is it both?
I definitely see both. We see a lot of adults for first-time diagnoses, and it is so interesting to hear sometimes as we're asking specific questions that might be related to symptoms, they're floored by the fact that that is even a thing. Like, wait, I didn't even realize that I was spending so much time and effort doing, things like eye contact. I didn't realize I had to think about it so much because I do make eye contact, right? So in those ways, they may not have noticed and it was more unconscious. A lot of our later diagnosed, a lot of these higher IQ kids do know. They see their peers and they learn from the social context. And so they are like, oh, I saw Jerry do 5, check-ins with the teacher. So I need to do 5 check-ins with the teacher with my eyes. And then you imagine how much that conscious effort really takes a toll on how many other things you can even be thinking about or focusing on.
Right. And you gave that example of Jerry. What else can camouflaging and masking look like? What are some examples because I can imagine some listeners are like, I don't even know what that might look like.
Yeah. I think about it overlapping as well with some of our kids who have both autism and ADHD. And so often, right, the body's need to move is really, kind of tightened up within the environment of I need to sit in this chair. I need to look like I'm focusing. And I think a lot of our, masking individuals, we think about girls, the female presentation of autism or ADHD, and how a lot of those girls might be totally inattentive and missing what's going on, but they know if I sit here and if I look like I'm listening, I won't get in trouble. The teacher will be happy with me, right? I'm meeting expectations, but really they're missing a lot of what we would want them to be getting from that environment.
Yes. And I'm so glad that you mentioned girls, because I've seen how social learning and expectations can quietly reinforce the message of fit in, don't stand out. Fit in, don't stand out, which can make these strategies almost automatic over time.
Totally. And yeah, one of the things I really like doing during assessment, especially if I'm assessing a girl in school age, kind of grade school years, I love doing school observations during recess, because this is where you really see not totally unusual behavior, nothing that stands out often for these later diagnosed kids, but they are circling, right? They're going around the playground. They might go up to someone, check in, keep moving, look busy. Right. So there's all of these things that they know this will make it so I don't stand out socially, but there also is not the quality of the socialization that we want to be developing during those school age years. But those are the kids who get missed, and they miss those years of intervention when we really, really want them to have support. So that's, why it is so tricky with masking to make sure that we're staying on top of it and explaining to parents and teachers, right? Even if it isn't a problem per se, we really want to make sure that they're getting support early on if any of these things might be more effortful or more difficult for them.
Right. Because it seems like that high effort can contribute to that internal distress and that anxiety that you mentioned before.
Exactly. And a lot of these, young kids and girls too, they know that they're not fitting in, but they might not be able to put words to it. And they might not tell anyone because they are trying to fit in, right? They're trying to mask. And so they don't want to bring attention to it. And so they're not bringing it to anyone's attention. And it is over time creating this internalized anxiety of everyone else can do it. Everyone else is succeeding and having friends. Why isn't it working for me? I must just be bad at this. And then they start to withdraw from social situations, and that anxiety builds over time without intervention.
Right. And then, like you were saying, they're looking at other individuals and trying to kind of follow what it is that other people are doing, but then it doesn't feel authentic.
Right.
So that can probably further contribute to the anxiety.
Totally, right? I'm trying to do the thing and the thing doesn't feel natural, or it doesn't feel quite as good as the next person's. Yeah, I hear that a lot. And again, even when I'm seeing these late diagnosed adults over time, when they reflect about middle school and high school, sometimes it's the extreme bullying situations, but often it's not. Often it's just like, I never really found my click and I wasn't really sure how to. I wasn't really sure how to connect the way the other kids were.
Right. And you talked about, autism in girls and autism and even ADHD in higher in individuals with stronger cognitive and even stronger verbal abilities. Why do we see higher rates of masking in girls and those with higher problem-solving abilities and verbal abilities?
Right. Well, I think one thing you mentioned at the beginning is there is still a lot of this assumption of what is autism, and it's often these clear signs, these clear things that we see. And so many people see a really verbal kid and don't think autism because they are able to socialize, right? Maybe not as effectively as the next kid, but they're able to pick up, if they have strong problem solving abilities, they're able to pick up on these cues. They're able to figure out how to use what they have within their environment to fit in as well as possible. And so that's often that presentation that we're seeing in the later diagnosed kids and through adults, because they were able to use their cognitive strengths in a really powerful way. And often we have parents who maybe have some neurodivergence as well, but are super, super successful. And so they see their kids and they see themselves in them and they're like, well, it worked out okay for me, right? I did well. And so those, again, are those conversations that we're like, yes, and I expect him to do well too, but we really want to give him all the support that we can as he's learning these skills.
Right. It's like masking, but there's a cost to that masking.
Totally.
And that intersection between neurodevelopment and social context is important as well, because the ability to mask doesn't mean that the underlying challenges are not any less significant, right? It's like, oh, you can hide your hyperactivity or your difficulty with reading social cues. But again, that doesn't mean that they're not there.
Right, right. Yeah. And definitely the end of the day when the parents are just saying, I don't know what's going on, they come home and they completely crash, right? I like to talk to parents and individuals, especially as they're getting older into teen years, teach them about the idea of spoon theory, right? We wake up, we only have so many spoons. Spoons are our amounts of energy that we can use throughout the day. And if we have to think about eye contact and we have to really control our body to sit still, we're holding it in all day, our spoons may be completely gone by 3:00. And so when that's the case, right, we can't really expect, we really need to be building in times for regulation, for breaks, for our social battery to have time to recharge, right? Otherwise, it's going to look like a fall apart at the end of the day, for sure.
Right. And that's so interesting that you say that, because so many families that I see will say, you know, they seem to be fine at school. They hold it all together, but then all the meltdowns and the tantrums and the dysregulation happen at home, and they just don't understand. It's because they're trying, a lot of kids and teens are trying so hard to hold it together in an environment where they're going to be judged and where they can be easily embarrassed, and where they are around people who they want to befriend, so they don't want to stand out.
Yeah. And I remind parents, like, you are their safe space, right? That is really important. And that is a beautiful thing that they are able to come home and let it all out, even though we would really love them to be regulated. But you are their people, and they know that regardless, you are going to help and support them. And sometimes that helps, sometimes it doesn't, depending on the stress level within the family. But it's a good reminder.
Right. And masking occurs in a number of neurodivergent individuals. Does it look different in ADHD compared to autism? Because I know you mentioned some overlap there.
Yeah, I think about it pretty similarly in both. And many of the individuals that we see have both diagnoses and really are kind of struggling with symptoms of both. And so, you know, I think in terms of autism, I think of masking more as the social norm masking and the behavioral, the emotion regulation. You know, a lot of kids who are struggling to regulate in school are holding it in emotionally. And then with peers at school, they're holding it in socially and able to try to replicate the things that they think will be most successful. With ADHD, I just think it's sometimes an energy. I need to remember not to interrupt. I need to remember to try and, you know, use all of the skills I know to help with my executive functioning. So slightly different, but I think these things really go together, and even more spoons, right? They're using if they're managing both.
Yes. And, you know, I've seen many kids, especially those with those co-occurring profiles, who are misunderstood because their outward appearance or their presentation doesn't match traditional expectations. And a lot of that is because of the masking that they're doing. It's like, oh, they're getting good grades. Oh, I see them eating with, these girls at recess. So everything must be fine.
Yes. Yeah. And I've even heard some providers that say, well, if the teacher's not calling home saying behavior is a problem, then they're probably okay. And to me, that's the essence of masking, right? It's just like, no, they might not be okay, even if they're not a behavioral problem or something really obvious. They might be missing it or just spending so much more effort in those days, those school days. So yeah, I see that a lot.
And when we talk about the cost of masking, I feel that this is where the conversation shifts from adaptive to potentially harmful. What would you say about the kind of that cost of masking for extended periods of time, especially when you're talking about assessing individuals in adulthood?
Right. Yeah. And this is the conversation I have with parents when they're on the fence about diagnoses and getting in a full assessment is just, I tell them, I see these kids all the time in later elementary to middle school. And by the time they come to me, they have anxiety and depression. And part of that is because they did not have a self-understanding of who they were. And part of that is because they felt like they just weren't keeping up with everybody else. So they were spending so much effort and time and mental load trying to do that. And because of that, over time, that developed into, I'm not good enough, kind of the depression, right? What's even the point? Why am I even trying? And then the anxiety of like, why would I go into this social situation? Because I just keep failing and people, I can tell, right? My cognitive skills are good enough. My problem solving skills are good enough to know I'm being judged and I'm not being accepted, but I can't figure out how to fix it. If we get those earlier diagnoses, we can build in the identity. We can build in some of the tools. And with that, there is always this conversation that I have with clients about the pros and cons of masking. Masking is not all bad, as we talked about, right? There are adaptive ways to mask. And so it is like, I want you to have the tools and the skills. And then we are going to learn about your energy management and your social battery. And you're going to have to be really thoughtful about, are these moments where it's worth masking and camouflaging within the setting? Are there moments where I really just need to go with whatever feels most natural to me because I need to recharge and I really don't want to be using all of my energy on those things? So over time, that can really help build someone's own confidence and self-identity of, I know who I am, I know my strengths, and I also know when I might need a break and I might need to not try to fit in all of the ways.
Right. And I see it too, the depression, the anxiety that comes with not understanding why you're struggling. And then you also see the low motivation to continue to persist with the masking and withdrawal. It's too hard to just, mask all day long, that you just withdraw into yourself or from social settings or even from academics. They don't want to go to school. There's school avoidance. A lot of other things can happen down the road.
Yeah, I think the social motivation piece is interesting because it's not always so straightforward of, oh, they're just not that socially motivated, right? It might actually be, they could potentially be socially motivated, but they were given too much negative feedback and then no longer wanted to try. So it is a balance because, in neuroaffirming care, we don't want to push someone to be social if they really don't want to be social, right? But we want to make sure we know what's behind that. And if there is any anxiety that's really causing them to avoid those situations versus actually not being interested in those situations.
Right. So, we've talked about assessments on this podcast before. You do assessments for autism. And what I often see, and particularly when we're looking at middle school, high school adults, I was just on a call this morning with someone who's thinking that autism might be in the picture, and it's a woman. How does masking contribute to delayed or misdiagnoses? And I think this is particularly important for girls and high achieving students because I see it more and more. Mm-hmm.
Yeah. I mean, I just think it's so likely that they don't get diagnosed until later. And, I've already kind of talked about some of the limitations of that. If they aren't diagnosed, it really creates a lot of problems. And so we tend to see a lot of kids through adults, right, who have already gotten maybe 5 different diagnoses that weren't autism. They've already been in partial hospitalization programs. Some of our adults have been through residentials, and autism was never considered or never understood. And so to me, that is the cost of masking. And I find adult assessment to be really, really fulfilling because it is often the missing piece. And it's so therapeutic, even though in adulthood, we often don't have too many like, aha, here's the therapy that's going to fix all the things that are really difficult for you. But it's just the understanding, right? This makes so much sense of why this has been so hard. And people have given me maybe an ADHD diagnosis or an anxiety diagnosis or a personality disorder diagnosis. And that never felt quite like it encapsulated what I was going through or what I was really struggling with. So yeah, I think that is, but especially women, right? They're so able often to fit into the social world, at least to some extent, that is not flagged and might have been called something else. And so they really continue to struggle and are usually, underemployed in adulthood or still kind of struggling to make friends through the teen years and not feeling quite like they're fitting in the way that they should be.
Yeah. And it's so interesting because I often see students who are identified much later. And it's not because the signs weren't there. Like you're saying, it's because they were well hidden.
Right.
But they were there.
Yes. And not everybody knows what to look for, which is part of why, I feel so passionate and, a lot of us feel so passionate to really advocate for what autism is in terms of the entirety of the spectrum, because many parents are still only aware of the more classic presentations and signs. But if we can get in there, especially even like I love if we can see a 3-year-old and really start giving parents strategies, even if it is a really subtle presentation at 3, and the diagnosis may matter or not matter, but can we really start thinking about how to support that child from a younger age is really, really important to me. But we can't do that unless the teachers and the parents and the communities know what they're looking for in these more subtle cases.
Yes. And what are some of those subtle signs that a child might be masking, that autism might be present, even if they seem fine at school?
Yeah. So in school age, often it is quality of friendships. And so often we'll see there is some socialization. Maybe teachers are even saying they're fitting in the classroom. That's why I say recess. I love to see lunch and recess because those are times that are unstructured. And so the ability to socialize is going to be it's going to require so much more, right? You have to find your right group. There's probably a lot of small talk and conversational talk, especially amongst girls. And you really kind of have to structure yourself within your social world. So that's often where I will see those kids who in the classroom, they look great, right? Maybe inattentive if they have ADHD too, but socially they're doing the things that the other kids are doing. They're sitting when they're supposed to be sitting. But recess can be the time that is a little bit more tricky. I also think in a lot of these subtle cases, some of the things, we don't necessarily have the big restricted repetitive behaviors, but we probably have inappropriate interests that might be really intense. My kid is into baseball, and that's actually all they spend their time doing. And that's the only, activity that they are thinking about. They're memorizing the facts. They're spending time outside of their hobby. So some of the restricted interests that are often appropriate for their age, and the sensory differences. Often we'll see at least subtle sensory differences that might be interfering. And, it might be picky eating, or it might be, I notice my kid paces back and forth throughout the day. Again, not necessarily super obvious signs, but signs that I'm always looking out for. And often if I, even do an adult diagnosis, the parents might even note some of these things way, way later on, but say, I didn't think anything of that, right? They kind of had friends, but their friends didn't like the same things they liked. And so it was just the neighbor kid, they would just sometimes spend time together. I don't really know that they had any similar interests. Those are the types of things I often see.
Yes. And what has your experience been like with these later diagnoses in terms of providing information to families about this is what it is. This is autism, and it's been there this whole time. It's interesting because I've seen so much relief from families, and definitely from individuals who are, young adults, teens.
Right. Definitely relief is usually the response. And, I feel lucky in that I work for an autism specific clinic, right? And so when people come to us, usually they do have some inkling of I am coming here because I am ready to determine whether this is part of my child's profile. I know for probably a lot of neuropsychologists, that is a much harder journey because a parent comes in completely blindsided by the idea that autism might be in the picture. We have it a little bit easier, I will say. But yeah, usually that is why it feels like such a therapeutic kind of release of I've gone to these doctors. We've kind of always tried to figure out what was going on with my child and support them the best we could. And nothing really seems to be working well enough. And finally, this fits. And I think as a clinician, really meeting them where they are, using the words that they use, and explaining how autism might not have been on the radar and that wasn't their fault. And, the fact that it was missed is actually really common. And so I talk a lot about these later diagnosed cases and why they're later diagnosed. And I explain the cognitive strengths and really say, your kid has all of these superpowers. And that's why it wasn't obvious from a young age, because they were actually doing really, really well in a lot of ways. And this new information can help us support them even better going forward.
Right. And it can be really empowering for young people to get information that lets them know that the reason why they've been struggling is because their brain is just wired differently. And they're in environments that don't support the way their brains are wired. And so now that we know this, we can ensure that they're getting the support that they need to thrive, and they have a better understanding. So they're not telling themselves things that aren't true, and we often see kids who have this internal narrative about why this is so hard, why kids don't like me, why, I'm struggling in this way, why I don't get invited to birthday parties. And that can be very demoralizing. But this process of assessment can be very empowering.
Totally. And we do see kids sometimes come in who had a diagnosis, maybe even from an early age, but parents haven't been forthcoming with them about it. And I am a very strong advocate of we need to tell our child how their brain works. And it doesn't need to, it comes from the stigma, which is why, again, advocacy is so important to me. It doesn't need to be stigmatizing, right? We can explain how our child's brain works to them in a way that is super strengths-based, but also points out the things that are going to be harder, just like everybody has things that are going to be harder, and letting them know that there are supports, there are people who can help, there are skills that can help, and there are people that we can find in our world who are maybe going to fit in better with. And so not having that information really sets them up to create some of these internalizing disorders and symptoms. And so I really I'm honestly pretty upright with parents, even if they really disagree with me, because I feel so passionate that this is really important.
Yes. And it can alleviate a lot of the anxiety and, contribute to even a stronger self-concept when this information is provided.
Yeah. And also I think the word neurodivergent has really, I think, taken off. And I appreciate that as well, because for families who still really hold on to the stigma that the word autism holds, we shift to the word neurodivergence. Knowing that my brain is wired differently, I might not need to know specifically all of the things, but just knowing that might get me at least pretty far. And so some parents, I'm just kind of reading where we are in our journey of understanding neurodivergence and autism, and we're taking it step by step, because that is a nice kind of general term that can explain that concept.
Yes. And I think in addition to the masking, it is that fear and that stigma, fear of a diagnosis and stigma that can also contribute to delays in identifying autism or ADHD when it's there.
Totally. And I found it really interesting. I have 3 kids myself, and being within parent communities, there is a lot of reassurance from parent to parent. Oh no, he's doing great. Why would you be worried about that? Right. And it's socially, it's just to support each other, right? People have no bad intentions, but knowing what I know, I'm like, oh my gosh, no wonder so many parents, even they flag a concern and their friends are like, no, but he's only 3. He's great. He'll make friends, he'll catch up. And I think a lot of pediatricians, a lot of teachers, right, they have that same, for positive reasons. They are trying to support and make someone feel okay. But it doesn't always help in the long run, because I think it really is just creating this sense of sometimes reassurance, or sense of like, why do I think there's a problem and everyone else is telling me there's not? Am I crazy as a parent? So I think that happens a lot in our community and really can delay diagnoses further because parents are like, well, everyone said it was good and I'd rather believe my child is doing well, right? It is in my best interest for my child to be doing well. So if other people are going to say it, I'm going to believe it, even if maybe extra support would be helpful.
Yes. Are there things that parents can do to support this idea of authenticity and reduce the need for masking without making a child feel exposed or unsafe? I'm thinking about parents who might be listening, thinking, I think my child is doing that, or I've seen this, and they're doing it to feel safe and to feel included. But it's like this balance because we want to support them being their authentic selves at the same time.
Yeah. Yeah. I think just normalizing we all have different things that are most comfortable for us, right? And almost talking about this in like a neurodivergent neurotype type of way, right? My brain might like this thing, your brain might like this thing, both are fine. And, if you notice your child, say, isn't always looking at someone in the eyes, that isn't something you need to encourage unless it's really important, right? And I think talking to them about, I noticed that you like to look out the window while we're talking. Wow, look how beautiful the sky is today, right? Actually noting and encouraging that they can be their authentic self without correcting. I think part of the reason things like ABA has gotten such a bad rap is like, we don't need to keep telling someone to look in our eyes, right? Like maybe in some contexts that's going to be important to make eye contact, but also it's not always. And so I think as parents, we're often trying to shape our child almost too much in a way that we say, oh, but kids are supposed to look in the eyes when they talk to an adult. And so if they're not looking, I'm going to say, make sure you look in their eyes while you're talking. Or, that might be important. And sometimes, but also I think just the comment about, oh my gosh, the sky is so beautiful. I see you're looking at it too. We can really kind of normalize, especially the sensory stuff, right? I can tell your body feels really energetic right now. I wonder if a big squeeze might help. And so if we just normalize that in our day-to-day routines, right, they're not going to think this is weird, this is wrong, versus if they're running back and forth and we say, stop running, you're in the house, you shouldn't be so active. I think we need to be thinking about like, they are doing all of these things for a reason and they are trying to be their best selves, right? Especially these young kids, like they are not doing anything to try to create harm. And so we can comment on things without necessarily correcting them, even if it might not be a neurotypical behavior, because we want them to feel safe and we want them to feel supported. And the more we model that in our community too, right? We're on a play date with another kid and the parent is saying, oh my gosh, Joyce, you have so much energy. Let's go run it out. Let's go squeeze. The other parent might be like, oh my gosh, that's some really cool parenting you're doing. And they may start modeling after that too, right? To make it more acceptable.
Right. Yes. And I think that's just such great advice for parents and for educators to know that they can kind of join these kids in meeting them where they are and giving them what it is that they need. Because that's what the support really looks like. If a kid really needs to move, I see this with teachers do this all the time. When they see a kid in the classroom who can't stay seated, they'll say, hey, Jimmy, do you mind running this over to the principal's office for me?
Yes.
And that gets them out of the classroom, out of their seat and walking.
Yes.
Right. And so there are lots of different ways to do that.
I mean, I love our educators, and I just think there are so many great teachers who are really actually well informed about neurodivergence. And I think about that so much in terms of this whole camouflaging thing, right? They are the people who are seeing the kid when they are masking the most. And so they are so powerful in being able to support these kids in regulation and allowing them to feel like they can be authentic in these environments. But just the way classrooms are set up, right? There's more of the bouncy chairs and there's more adaptive seating and breaks and moving around. And I think that is so important because I've seen the opposite in classrooms too, where it is definitely like a punishable behavior to be hyperactive because the teacher might not understand that there's a reason behind it's not just bad behavior, right? It's really the body's inability to regulate in those moments.
Right. Yeah. And, when we're talking about masking, the goal isn't to take away the masking. Like we talked about how some of it can be adaptable, but to expand environments where they don't feel they need to use it.
Right. The ultimate goal, yes, is that we can have a world where we don't need to be neurotypical to fit into it. And that's, again, where the advocacy comes in, right? How can we really continue to make this more inclusive environment and world that our kids can be themselves no matter what? And again, I see some really promising things at schools and really encouraging the inclusive environments and including the buddy bench at recess where you can find a friend if you can't find one, and someone will come up and say, hey, would you like to play with me? I just think the social emotional curriculum that is going on in a lot of the schools at this point it just warms my heart, because I know I didn't have that when I was young.
Well.
It's
yes.
amazing.
Yes.
So yes, I think we are slowly but surely getting to a place that is more inclusive and more accepting and will not require that amount of masking that it did in the past. Yeah.
And that is a beautiful thing.
Very beautiful thing. Yes.
Dr. Dow, I can't thank you enough for this conversation and all of the insights you've shared. If listeners want to learn more about you, your work, and your team at Spectrum Psych, what is the best way for them to connect with you?
Yes. If you go onto our website, it's www.spectrumpsychla.com. Psych is PSYCH. You can find us there, and there's ways to contact us directly. And we would love to hear from you. If you have any questions or any interests, we have some groups going on. We have individual services. We also have a nonprofit that is throwing some events for free. One for advocacy is coming up. We also have an adult social group that's happening for free every month. So would love to connect. Yes, please find us there.
Yes, wonderful. And I will put a link to your website in the show notes for sure. There's just a host of great resources there. So thank you so much for all that you do.
Yes, you too. I really appreciate you having me on today, Karen.
Thank you so much for listening, and be sure to check out the show notes for more resources related to autism, how it presents in girls, and the overlap between autism and giftedness. Please also be sure to reach out to Dr. Dow. Her information is also in the show notes. If this episode resonated with you, please share it with a parent, educator, or clinician who you think would benefit from this conversation. Thanks again for being here. Until next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.